My name is Susan Gulich, and I'm an RN to BSN student at Cedar Crest College, and the purpose of this video is to discuss how I met all 8 of the clinical objectives for Nursing Leadership 335. Most of my objectives have been met through my professional experiences. Objective 1 is to apply knowledge from previous courses in the physical and social sciences, humanities, and nursing in meeting the multidimensional needs of individuals and groups within the local geographic area. A&P and Nursing 311 have helped me perform accurate patient assessments. Pharmacology and nursing dosage calculations help me give medications accurately and provide teaching to patients on medications. Bob Dylan and the Beatles was a class that I took about the 1960s era. I didn't think that this class would help me at all in nursing, but it actually has. I work on a rehab unit where I care for a lot of baby boomer generations, and the 1960s are a very important time for this group of patients. So sometimes if I see a patient with like a Vietnam hat or a jacket, we'll strike up a conversation. I'll thank them for their services, and a lot of times they want to tell me stories about this time period, and I feel this helps build a rapport with my patients. I got my nursing license in 2009. I do the 30 hours of continuing education credits every 2 years. This helps keep me up to date in practice. I have a CPR certification. I was previously certified in chemotherapy and pediatric advanced life support. I also attend nursing conferences to stay up to date. Objective 2 is apply the basic principles of ethics, management, and leadership to meet the needs of patients and their families. So when I plan my day in the morning, I usually see patients I always see patients based on how their night was. If they were having trouble over the night, I'll see those patients first. If a patient's in a lot of pain or diabetic, I usually see those patients first. I don't choose to see patients by their race, gender, or social economic status, which is distributive justice. I also try to act with fidelity or truthfulness. I let patients be aware, if I'm with another patient and it's going to be a little while until I get into them, I do let them know that I'll be back to them, and I try to give them an accurate time frame. Sometimes patients want to refuse certain physician orders, such as fluid restrictions. So I know the patients have the right to refuse, but I always act with beneficence by providing them information, such as with the fluid restriction, giving the patient information on CHF, the importance of fluid restrictions, verbal and written information, making sure that they understand the consequences or the potential side effects of not following a fluid restriction. And if I'm confident that they understand, what can happen if they don't follow it, then I allow them to have the autonomy to make their own decisions. I feel if I didn't provide teaching and information, I would be acting with maleficence. For leadership, I'm part of committees in my hospital, such as Safe Patient Handling Committee and Skin Integrity Committees, which helps me with quality improvement. Also for management, I work as a charge nurse sometimes. I never had a formal management position, but I do work as a charge nurse, help making assignments, help with difficult procedures, patient complaints, etc. I think I work as a democratic form of management because I usually collaborate with other nurses regarding, changing a patient's room or admissions and discharges. I try to keep it fair for everyone and work together to be fair to everyone. And if I have to move a patient, I ask the other nurse, like, hey, I was thinking of moving them to this room. Is that okay with you? Do you have any other ideas? And we work together to make a decision. I did act with an authoritarian style of management in a critical situation. One of my coworkers thought that her patient was having an MI. So while she was on the phone with the doctor, I was delegating different tasks to other coworkers, and I kind of just took over that scenario to ensure that things were getting done so that the patient could get the emergent care that he needed, which we learned in class. Authoritarian style of management is effective in crisis situations. Objective 3 is to evaluate the effectiveness of communication in promoting the optimal health of patients and their families. So I take part in care plan meetings on my unit. Sometimes the care plan meetings are just with other members of the team, such as therapy, the physicians, case management, nursing, and other care plan meetings involve the patient at the bedside. I think these meetings are really important so that everyone's on the same page and can collaborate together to get the patient safely home, or whatever needs whatever services they need to get them safely home. Also, when the patient's involved, it helps keep them up to date and gives them autonomy to help make decisions in their healthcare. Safety huddles, we do these after report in the morning, and this helps everyone be on the same page of any potential safety risks on our unit. Bedside shift report, this helps keep the patient informed and an active member in their care. And then the patient logistics experience, this was one of the clinical experiences that I attended as an RN to BSN student, and it helped me see the butterfly effect. The nurse I was with, she had to get an ICU bed for a patient, and we were just talking about, if the census is really high in the hospital, she might have to collaborate with other physicians, charge nurses, case management to get the most stable patient moved from the ICU to PCU, a patient from PCU to med-surg, a patient from med-surg to rehab or to home, and that's where I come into play all the way down the line. If I have a patient that's supposed to be discharged and I can't get this patient discharged in time for whatever reason, I have to communicate effectively with the doctor, case management, bed management to let them know why I can't and what I can do to get this patient discharged, because it could potentially be holding up a bed that's needed in the ICU. Objective 4 is critically analyze and integrate leadership research findings into the total plan of care for a selected group of patients and their families. So for this, I researched the ethical topic of mandatory influenza vaccinations for healthcare workers. I found many things regarding ethics and this topic. I found that mandating healthcare workers to receive influenza vaccines can be a violation of their autonomy. It can be beneficence because it can protect patients from potential illness. It can be seen as maleficence if you don't mandate it, because it can put patients at risk. And it can also be seen as maleficent because the healthcare worker might view the vaccination as harmful towards them. Also, distributive justice comes into play when there's a shortage of the vaccine. It has to be divvied out to the most vulnerable patients first. As nurses, we have to act as change agents. This is a newer change. It happened in my hospital a few years ago, and there's a lot of resistance from it, so we have to be educators to other staff members and positive change agents. We also have to nurses have to participate in more research on this topic regarding patient outcomes. Also, bedside shift report was a topic that I researched for my Nursing Research 2 class. And I found that bedside shift report does increase nurse satisfaction, patient satisfaction, and patient safety. So I act as a leader in my own practice, because a lot of times I do see nurses giving report at the desk still. So I take it upon myself to always give report in the room and to include the patient. And I think I'm acting as a leader because I know that this is what's best for the patient. Objective 5 is to apply the principles of ethics, advocacy, and teaching to the everyday care of patients and their families. So recently I attended a nursing conference, and one of the speakers spoke about the opioid crisis. So I had researched this further, and I've actually changed my practice to make sure that if I discharge a patient home on an opioid, that I definitely discuss how to store the medication, not to share it with anybody, etc. And recently I had instructed someone on a fentanyl patch who had no idea how to dispose of this, and I said you got to fold it in half, flush it down the toilet. You don't want any children, pets to become in contact with it because it can be very dangerous. And I think the patient was he was very thankful for this information because no one had ever told him that before, and he actually ended up discussing it with the doctor about how he can start weaning himself off of this and use different alternatives. Recently, also, I had collaborated with other nurses. We had a patient who was losing his battle with lung cancer, and we had to advocate for him because he really wanted to be discharged home, but it was a weekend and we had no way of getting him home. So we had worked together to get this patient transferred down to hospice, and then from hospice in the morning he was transferred home as per his wishes, and he was able to pass peacefully in his home. So this was definitely a scenario for advocating for the patient's best interests. Objective 6 is to formulate plans for continued personal leadership growth and development as an independent practitioner of nursing. I want to go ahead to obtain my certification for med-surg nursing and wound care, and a wound care certification. I want to attend more nursing conferences because it helps me feel a sense of empowerment and motivation. I want to assist with more changes on my unit. And also I would like to be a preceptor for nursing students after I obtain my bachelor's degree. I just feel like I would like to be a positive mentor for other new nurses and be someone that they could come to with questions or concerns and just help them along the process of becoming a new nurse. Objective 7 is to recognize the role of the nurse in policy making related to healthcare services at local, state, national, and global levels. So there was a meeting, a lecture from PSNA, and that helped me realize, it's really important to join these organizations to stay up to date. There's strength in numbers. So if us as nurses, if we can come together for policy change, it's really helpful. Capitol Hill Day, I learned more about specific bills related to nursing, such as Senate Bill 214, which is about nurse-to-patient ratios. I had talked to a representative about this. I learned that this bill is still in committee. It takes a lot of time and a lot of money to pass bills, so it's really important for us as nurses to come together and to stay persistent in, getting these bills into Senate for voting. And I got this in the mail, and it's about it's a message for the state senator and state representative on safe staffing. And I kind of just threw it to the side. But after taking this class, I realized that it's really important for me to fill out this survey because it will go to my state senator and state representative about staffing and, help keep patients safe. And I didn't throw it away. For some reason, something inside of me kept it around, and I'm definitely going to fill it out and mail it back. So at least if I'm not part of a professional organization, at least I can mail this in and have like a little part in safe staffing. Objective 8 is predict and describe potential ethical dilemmas within clinical, organizational, and professional nursing practice. I feel that staffing issues have been a problem since I became a nurse in 2009, and I can predict that, staffing will be a continued ethical dilemma because if you don't have enough nurses, it can take away from safe care to patients. Hospitals are trying to save money in their personnel budget, and that can affect patient care. I learned in class that technology drives ethics, so everything in nursing is getting more technologically advanced. There's now video visits, an online portal, and I feel like this has the potential to miss some information if a patient's not familiar with how to work a computer or is not up to date on computers, but also if a patient is up to date on computers, then it can be very beneficial for them. So it could go either way. Also, potential changes to the Affordable Care Act, such as Planned Parenthood. Cutting funding for Planned Parenthood can put a lot of women in jeopardy as far as birth control, having abortions, having children, cancer screenings, etc. Also, Medicaid cuts. That can be a potential ethical problem with patients getting the care that they need. And lastly, the medical marijuana program, which it was approved in April of 2016 in Pennsylvania, and it's important for nurses to advocate for patients, know who can prescribe it, how to safely use it. It's still seen as illegal in some states, so this can be seen as maleficence, and it's important to give information to patients so they can have, the autonomy to choose if they want to try, this as an alternative medicine. So there's a lot that can be done with predicting future ethical dilemmas. So that's all. Thank you for listening.